Um, Thank you, Inna, for the introduction and Artem
Mhm.
for the first words. I'll now try and oh, you have to still activate me so that I have so that I can now it works.
Mhm.
Uh-huh. So I think now you see the slide, yeah. And yeah, so what I want
Yes.
to yeah, what I want to talk about today has three parts. The first part, and I promise the shorter part, will be my groundwork on the basics of what we know, how the brain processes temporal information and related psychological states, waiting time, flow states. And so I'll inform you about how we as humans perceive time. But I'm not just doing, are you still seeing my slides?
Just one moment, Mark. Could
Uh-huh.
you request one more time for share presentation? Yep.
Okay, I'll do that.
Yep.
Oh, I have to request, so I just
And
requested.
yes, that's right. So you could proceed. Yep.
Okay.
I just rolled it organization
Uh-huh. So
to
you
my
see it
page.
again, I guess, yeah.
Yeah. Yeah, perfect. Nice.
Okay,
Thank you.
so the first part, as I just started, is about basic research on time perception. And then I'll go into the second, the long part on altered states of consciousness, where I want to present to you some alternative method of altering states of consciousness, and that's floatation-REST. So I'll just talk about this. I'll let you know what this is. And then I'll provide a context and open this context up for a discussion where I want to explore then the anxiolytic properties of floatation-REST. In short, floatation-REST is you're lying in a cabin, you don't see anything, you don't hear anything, you have body temperature water saturated by salt, and you have a total relaxation response. And after a while, you can get into altered states of consciousness. I will talk about this also in the context of psychotherapeutic applications. So three steps I want to talk about. Okay, so this is first of all, how in the brain do we process time, or how does the brain process time? And this is my work from San Diego at UCSD, where I worked, and I could show that when subjects had to judge duration of several seconds intervals, that one region in the brain, the insular cortex, showed increasing activity over time. So the longer duration, the more activity over time, which ended at the end of the to be timed interval. So that's the brain. Insular, and the insula is the primary interoceptive body cortex. So it's responsible for receiving body input. So we have a sense of our bodily self. Then in a further study, we could show that the heartbeat slows down during the timing of the same intervals. And we had a very nice correlation between the heartbeat slope and duration estimation. So the steeper the heartbeat slope, the longer the duration estimate. So what we have now is a correlation between the heartbeat, insular cortex receiving signals from the heart, and time perception. So this is the embodiment of time. So what is the insular cortex? So you could say that this is textbook knowledge. It represents physiological conditions of the body. As I said, it's about the homeostatic regulation of physiological needs. So when we're thirsty, hungry, if we feel pain, if the temperature is high, low, this is all body feelings which are processed through the insular cortex. But also we need these physiological states for interpretation so that we, as a basis of our complex human emotions. And there are a lot of, so all our emotions have also correlates of body states. And there are a lot of neuroimaging and lesion studies showing how the insula is related to physiological needs, emotions, but also complex decision making, where we have this pro-verbal gut feeling, yeah, in deciding for an option. But it's also about music perception when we're talking about temporal structure, emotion, or I'll come to this a little later, meditative states, where it's a concentration on the self and the bodily self. And so it's not just my research, but I got vindicated in 2023 when 2 meta-analyses showed with over 100 studies with fMRI, so with brain, with methods to show brain activity. And these 2 independent studies from 2 independent groups both show that it's only 2 brain regions related to time perception. That's the SMA, it's called, the supplementary motor area, which is important for sensory motor timing, or in philosophical terms, you could say enactive timing, the timing of my movements. And the bilateral insula, which is important for, as I just explained, for interoceptive time perception, so for embodied time, the feeling. So we could say, we with our body, we are our subjective time. And there are a lot of studies, I won't go into the details, but just showing that subjective body awareness as assessed with questionnaires predicts timing accuracy. Yeah? We have lesion studies in the insula. With lesions in the insula, people have problems in judging duration. Also, there are several studies showing how the heart rate, the direct heart rate, predicts subjective time. Yeah? And the heart rate evoked potential is another mechanism. So the heart rate potential, as recorded in the brain, is related to subjective time. And so all this empirical research is very, very much related to the work, the theoretical work by Bud Craig, who already in 2009 anticipated that the anterior insula, or the insula in general, will be related to subjective time. So it's actually very new and fresh results. This is a solution to the long-held time perception question. How does the brain and how do humans perceive time in the range of seconds and maybe minutes? It's all about body self. So it's really an exciting new revelation in science. So all what I'm talking about, so now moving on to more psychological studies, is that I say the self, it's all about the body self and time consciousness. So if we have an intensified awareness of the bodily self, we have an intensified awareness of time. If we have a weakened awareness of the bodily self, we have a weakened awareness of time. So it's an up and down regulation of subjective time through awareness of the bodily self. And we all know this from everyday life. Yeah? So in boredom or waiting time, we have an intensive or negatively felt overrepresentation of time and self. So we say, oh, time drags. But in flow states, during pleasant activity, we are absorbed in this, so much in this activity that we lose our sense of time and self. Time flies. So that's the endpoints between flow states and boredom. That's where subjective self and time fluctuate. So here's just one study we did, a waiting time study where people come into this room, and we had told them a cover story that we wanted to have them doing a computer test, a classic experimental psychology test where they have to press buttons. But sorry, our computer broke down, and please wait here until the experimenter comes back. We took away the cell phones, any reading material, the clock watches, etc. And they were alone there for exact 7.5 minutes when the experimenter came back and then revealed basically it was all about this waiting time. And the results were very clear-cut. So the stronger the sense of self, the more thoughts about time, the more boredom people had, the longer subjective duration, and the slower passage of time. And the video game study in VR, that becomes a little, I'll show you more of a VR study because this is also very interesting for therapeutic purposes. So Mihaly Csikszentmihalyi, he is this person who in the 70s and 80s talked about or brought into the concept of flow states. And the components of the flow experience, as he defined it, is an intense and focused concentration on the present moment, here and now. Then you have a loss of reflective self-consciousness because you're doing everything now. And you can have a distortion of temporal experience, and in peak states, even a loss of the time sense. We did a study with people doing the video game Thumper, either on screen or in virtual reality. And we very clearly showed that the more subjects experienced flow with a validated questionnaire, the faster time passed for them. That it was a 25 minutes game. So here is a waiting time, flow states in VR, just opposed experiences. So we had an virtual times, it was called, EU project, which ended in 2023. And the idea was to use the VR setup and getting people into flow states, especially patients, because what is known about psychiatric syndromes like depression and anxiety is people have a hyper-awareness of self and time. Time drags. The future is far away. I'm totally in the present, stuck in the present. And they have a lot of rumination and mind wandering. And the core features of the flow state, they actually work against the psychiatric symptoms, because you have less awareness of self and time, and you have a decrease of mind wandering. So this idea was to bring playing VR video games into also the clinical arena, inducing flow states in patients with psychiatry who then get a decreased awareness of self and time. And that was the idea behind it. And so here's a nice mini review from Frontiers journal showing how different psychiatric syndromes, depression, anxiety, schizophrenia, eating disorders, ADHD, etc., are related to time processing, interoception, and insular activation. So that's all what I was talking, all these slides. So this is the relation of the body itself and subjective time, and a distorted subjective time related to psychiatric disorders. And what especially patients with anxiety syndromes and depression report is this overestimation of duration, slowing down of subjective time. And this has been shown in behavioral timing studies, but also in subjective interviews with patients with depression on their subjective time sense. And so we had this VR tunnel experiment, and we were probing for design elements of which design elements would induce a flow state or a faster passage of time for certain durations when people were flowing basically or sliding through such a VR tunnel. And first of all, related, what we could show is that the faster speed of people flowing through this tunnel and the higher density of the elements led to a faster passage of time. So the more elements are there, the faster passage of time, as opposed to when there are less elements of this tunnel. That's some sort of interesting in itself if one wants to design a VR game for these therapeutic purposes. But what for me was the most important thing is what you see in these graphs below. Don't look so much at the details of the speed and fast and slow and etc. These were 20, 30, 40 seconds tunnel video durations we presented. And the people had to judge the duration of these segments, 20, 30, 40 seconds. And what we could show is that people just estimated on average only 50% of the physical or clock duration. So in the 40 seconds duration, people thought it was 20 seconds. In the 30 seconds duration condition, they thought it was like 15 seconds. So you have a massive underestimation of time in this tunnel situation, which was really surprising in the magnitude of this effect. So you see just already being in this tunnel vision gets you into faster passage of time as a marker for flow states. So Now, next chapter, this will be my main chapter. This was the introduction from brain to psychology every day to VR and flow states. And now we're going into flotation-REST, to the flotation-REST method, which I then will open later for contextualizing the empirical findings, how to use it in the psychotherapeutic process. So first of all, for meditation, this is related to the non-duality experience in meditation. So we have this dissolution of senses of self and time in a very experienced meditator. Yeah? I did an interview and he told me then the peak states of the meditation was, and he told me what it was about. The timeless awareness during meditation is an awakening. It has no beginning and no end. This timeless time is an immersion into a being where no comparing happens. It is timeless presence without the sense of an I, without observer. So down-regulation of the sense of self and time. And now, since you are a psychedelics group, yeah, we have the time distortion on ayahuasca. Benny Shannon showed in his, he wrote a book, he wrote many articles, what happens in peak experiences. In ayahuasca, he says there's no time, no self. And what you see here is different temporalities people experience during ayahuasca experience. And you see the modified temporality, the cessation of time, the modified rate of flow, a confusion of order, a confusion of directionality, that's about past and future. But in peak experiences, no time, no self. So when I highlight the sense of self and time, it is not just my personal selection, yeah, but it's what I want to show here. We just published review where we try to integrate all the models of altered states of consciousness from the 1950s, 60s, 70s to our time, and got all these from these models, the main classifications. We looked at the main classification schemes and extracted the main symptoms in altered states of consciousness. And it's all about perception imagery, that's hallucination, but it's also about bodily self, self-boundary. We have very often the mystical significance. It's all about arousal, so more or less arousal, and the time sense, which is very much affected. But of course, emotion and control and cognition. Yeah? So we have more dream-like cognitions very often. But you see, 3 out of these dimensions basically are related to the bodily self and time. And that's why I think it's so important to study these dimensions. So flotation-REST. So now we start with discussing this specific method. So we float in water at body skin temperature, so 35 degrees, saturated with Epsom salt. That's magnesium sulfate. You have no stimulation through external senses. There's no light, no sound. And the initial experience when you're in the flotation tank and you lie there is that actually you have an increased time awareness because you have increased interoception. You don't see anything, you don't hear anything. What you have is your bodily self. So you feel your breathing in, you feel your heart pumping perhaps. Yeah? But later during the float, you get to a loss of sense of self and time anecdotally. And this is why we conducted a study. And what I like to call this instant meditation, because during the float, but also after the float, what people feel is this relaxation response, strong relaxation response, and decreased mind wandering. And you don't have to be an expert meditator. Anybody, even without meditation experience, can get these, as I call, instant meditation experiences. And so I just now, in the next 10 minutes, I will talk about this first study we did, a quantitative study. We had 50 healthy volunteers who came into our study, and they had 2 conditions. Because why would I have a control condition? I have, first of all, the flotation-REST cabin, where people lay for 1 hour, but we had to have a control condition because people would say, oh, well, at home, if I'm in my bed, I shut down the windows, it's dark, I don't hear anything, I'm cozy under my blanket, so why do I need an expensive flotation tank? So you always have to show that the flotation tanks relative to a strong control condition has certain effects. And so we used this water bed. Actually, it was by chance in a salt room. There was no light, no noise. And people also lay there for 1 hour. So we have experimental condition, flotation rest, and the control condition will be called bed rest. So people come in. We had first a familiarization session, flotation rest, bed rest. So they just got to know all about how this worked for half an hour. They were and then there. Then we had a second and a third session, 1 week in between, where 1 hour in the floating and 1 hour in the bed rest condition. And then after each condition, we measured about their subjective experience. So we had looked at affective states, we looked at relaxation, stress, fatigue, about anxiety, but we also looked at altered states. So we used the PCI, the Phenomenology of Consciousness Inventory, and we looked at bodily self and subjective time. So these were basically the domains we were looking at to map out experience in flotation rest. And an important scale was this, which was invented by a French psychologist, Dambrun, he invented it for meditation, and we also used it for flotation rest, where you see that the response people had to give, how they felt their bodily self, the body boundaries were from clearly perceptible to only weakly perceptible. And first of all, here, everyone who was critical of this study and said, oh, I just go to home, to my bed, will feel convinced, because here is the first post versus pre-experience, bed rest and flotation rest. And you see in both conditions, we see there is a reduction in arousal, anxiety, tension, and stress. So we find this in flotation rest, but we also find it in bed rest. Okay, so both conditions are quite powerful, especially bed rest now is very powerful. But then what are the differences between flotation rest and bed rest? And what we showed that was in flotation rest, there was less anxiety, less tension, and actually less fatigue. This less fatigue is actually quite interesting, because it shows that, like meditation is not about sleeping, but of being actually very much awake and alert, but in a relaxed state, in a concentrated, relaxed state. And so we showed that in the bed rest, people were more fatigued than in flotation rest. So again, flotation rest, similar to, let's say, meditation. Okay, less anxiety, less tension. That's very promising that with the flotation tank, we have a means to even have more stronger effects than bed rest. But what are the differences between flotation rest and bed rest? And it's very clear that there was stronger time distortion in flotation rest as compared to bed rest. And there was a stronger loss of body boundaries. And you see how we measured this. First, the Dambrun scale on body boundaries, but also here a visual analog scale for how did you lose your sense of time during floating or resting. So clearly more time distortion, more loss of body boundaries in flotation rest. But then the question is this actually related to altered states of consciousness, or is it just some feeling you have maybe while being in ordinary states? You can also have less or more or less time distortion. And so we had this PCI, this questionnaire, which has 2 subdimensions, altered experience and altered state. And we very clearly could show the correlations, that the more altered experience, the more time distortion, and also the more altered experience, the more dissolution of body boundaries. So very clear we could show, okay, body boundaries is related to altered states of consciousness. And now we're coming already a step further into possible psychotherapeutic applications. So what we showed was that mediation effect, a statistical mediation effect. What does it mean? That the dissolution of body boundaries mediates the effect of flotation rest on anxiety. So the more loss of body boundaries in flotation rest leads to a stronger reduction in anxiety. So the anxiety reduction comes through the loss of body boundaries. And so first a recap for now. So we have for both flotation rest and bed rest a decrease in anxiety, tension, stress. Then if you compare flotation rest and bed rest, we have less fatigue, anxiety, and tension with flotation rest. And we have weaker body boundaries and more time distortion in flotation rest, and which are related to other states of consciousness. So you could say, and that is the mediation effect again, which is important now, anxiety is reduced through the perception of weaker body boundaries. So this could be a novel mechanism by which floating may exert its anxiolytic properties. This is very important. I come to this later again. So again, what I showed you before is, so maybe in psychiatric symptoms, this is in depression, anxiety, we have hyper-awareness of self and time, and through flotation rest, we can, which is basically against these symptoms of depression and anxiety, this hyper-awareness of self and time, because we have a reduction of self and time, the loss of self-boundaries and the distortion of time. We have a mechanism to help people with these psychiatric issues. And here I'll show you this published paper in PLOS ONE by Justin Feinstein from the US, who showed just a 1-hour float of patients with anxiety and depression, that they had a massively reduced anxiety and depression symptoms after just 1 hour of flotation. And later, they could even show what I later present to you, the afterglow effect, that this reduction of anxiety and depression lasted in a following paper. They could show this in a following study. It lasted for at least 48 hours. So it's not just directly afterwards, but it lasted for 48 hours. So this afterglow effect, what is this? So we did a study. So afterglow, as psychedelic researchers, this is after the acute effects have subsided, and for some days or even weeks, you are some sort of in an elevated, different experience. And this is termed, it comes from the 1960s, afterglow effect. And we did now a study of afterglow after flotation versus after bed rest. And so it was an afterglow effect of just about 30 minutes, but this is the first study where we could show this. And we have to expand, of course, also the time interval. So people came out, they showered, got dressed, entered the anteroom. People also in bed rest, which was a little unusual, had to also shower after the bed rest, similar, because they also did it in naturally after flotation rest to get rid of the salt. But we anticipated critiques that because people would say if we did not have the people shower after bed rest, people would say, oh, this afterglow effect, maybe it's just related to the showering. So we had to do showering in both experimental arms. Then they had a waiting phase for 10 minutes where they were just undisturbed and alone in a chair in the anteroom, just feeling what they experienced. And then we came with 5 scales for afterglow experience, which after an average of 26 minutes. And here's an afterglow inventory, which could also be interesting for you, because this is by a Berlin group. It has been, so Inna knows these people, has been validated. Now you just read for yourself a few of these items, like I feel comfortable in my body, I am thankful for my life, I feel love towards other people. This is mainly invented for psychedelic afterglow experience, but we used it also now for our flotation rest study. And what we showed was, first of all, flotation rest led to a stronger afterglow experience than bed rest. People were also more mindful, bodily related, mindful after flotation rest, and they had stronger interoceptive awareness of themselves. So afterglow, mindfulness, and interoception, these three domains were stronger after flotation versus after bed rest. So that's quite interesting to compare. At first, I had initially said the float experience is maybe similar to meditation experience. You have this relaxation, you have weakened body boundaries, time distortion. You could compare this to deep meditative states. And the afterglow, the psychedelic afterglow, you're also more mindful, you have higher interoceptive awareness. This is very much comparable to mindfulness. So the one is more the meditation experience during altered states, and the other one is more being mindfulness in everyday life. Okay, so I'm coming slowly to an end, and then maybe we can discuss a bit. So one idea is that you could use flotation rest in combination with psychotherapy, because there's a few studies showing by Annette Kjellgren from Sweden that the flotation experience before the psychotherapeutic process opens people up to their inner worlds, and then they're more able to articulate, and after they had floated. And you could also use flotation rest as a preparation for therapeutic psychedelic sessions, for at least for some people who never had really any experience with altered, or hardly any experience with altered states. This could be something like, whoa, this is something, a step before the psychedelic experience, where they can experience at least a very safe environment with flotation rest. And it could also be a low-risk alternative to psychedelics anyway, because as one knows, we have Inner knows more about this, but I think with the first German psychedelic study with patients with depression, there was a responder rate of something like 60% positive responders. So then you have other people who did not respond and other people who actually had bad experiences. So this could be an alternative to psychedelic use. And maybe, as I talked all about instant meditation, so flotation rest programs could maybe be built up similar to these MBSR programs, this mindfulness-based stress reduction programs, where people come in for 8 weeks and meditate with an instruction, and maybe one could do something similar with flotation rest. So this is my very last slide, and maybe you can write down this URL, this website. This is Justin Feinstein, my good colleague, who was also co-author of our very first quantitative study, which I showed to you with flotation rest versus bed rest. And he started maybe in the US around 2016-17, a new flotation rest study series. And he was also the first author showing that patients with depression, their anxiety symptoms are very remarkably reduced. And what he now started, he now lives in Hawaii. And there was just 2 years ago, I think there was a wildfire that burned down on this island of Maui, a lot of houses, and people are really in traumatic states. And he now managed to get the first movable flotation cabin to be placed in this disaster zone. You see a photo. And of course, as I'm speaking to a Ukrainian psychologist, this of course could also be an idea for other traumatic instances of war zones, that one could try and use flotation rest as a means to prevent build-up of trauma. What Justin Feinstein told me that in the US, Navy SEALs, when they're somewhere in combat and come back, so these are soldiers who had experience of combat. When they come back, these Navy SEALs actually already go into flotation tanks to prevent the build-up of trauma and PTSD. So this is my final slide to open up the possibilities. So I came from brain research, basic research in psychology on time and self, altered states of consciousness. I showed you 2 of my flotation-REST studies, and now it's open to also some practical applications. Thank you for listening.
Дуже дякую, Марк. Дуже цікава презентація взагалі, да, кілька таких аспектів важливих, які ви сьогодні згадали. Друзі, будь ласка, якщо у вас є питання, ви можете задавати їх в чаті або піднімати ручку і задавати питання уже особисто. І у нас вже є перший запитувач. Будь ласка, Вадим.
Дякую. Щиро дякую доповідачу. Дуже цікава доповідь і цікавий матеріал. Пане Марку, ми дуже задоволені вашими матеріалами. Хочу запитати, будь ласка, скажіть, з якими діагнозами пацієнти включалися у це дослідження? Чи там були хворі з рекурентним депресивним розладом, або біполярним, або ПТСР? Чи яка група, який рівень порушень мали ці пацієнти, щоб ми могли зрозуміти, у яких випадках перевірена ефективність цього методу?
Mm-hmm. So I refer now to this study I showed by Justin Feinstein from the US, who had patients with depression and anxiety and depression in this very first study. These were 50 patients, and they were patients who were treatment resistant to all other potential therapeutic interventions. So psychopharmacology did not work, meditation did not work, psychotherapy did not work. Because this was a very first systematic study in the US, only those patients were allowed into the study. This is very similar to the first German psychedelic study, that only people who were not responding to general treatment were allowed in the study, because it's the very first study. So you knew, okay, nothing helps, so okay, now they're allowed to have psychedelics, or they're allowed to go into the flotation-REST study. And they had several issues with anxiety disorders, and they had the main diagnosis was anxiety, but they had comorbid depression, some of them, and it was like generalized anxiety disorders, but there were also people with PTSD who were included. So you had a lot of, it was a mix of several anxiety disorders.
Дякую, дуже дякую. Скажіть, будь ласка, ще одне запитання. Ну, ми бачимо, що достатньо короткий курс був лікувальний, використано. Чи є розуміння, наскільки може зберігатися ефективність, якщо продовжувати кількість таких сеансів?
So this was the very first study I showed you, and as you said, it was just one session, 1 hour, and then people responded to questionnaires to see what the effects were. But a follow-up study showed that these treatment effects of one session of flotation-REST, the positive effects lasted at least 48 hours, because they were again asked 48 hours later. But you're absolutely right. So this will be, I think, will be the next steps of this team. It's in Tulsa, Oklahoma, in the total middle of the US, and they will continue, because just imagine, what do we do with psychotherapy? People come once or twice a week to psychotherapy, over weeks, months.
Так.
And the same with, let's say, meditation or something. But maybe one could envision something for the future that people come in once a week for flotation. So that you basically have people repeatedly come in and then see how this affects the anxiety disorders.
Можливо, да, навіть якщо ви не використаєте якісь дані саме з досліджень, ваша особиста думка, як ви вважаєте, скільки було б доречно використати floating-REST да, цього досвіду, як супроводжувальна терапія, да, додаткова терапія до звичайної терапії. Можливо, це повинен бути такий постійний курс, да, тобто там раз на 2 тижні, раз на місяць, якщо людина проходить курс там 6-місячної психотерапії. Просто ваша думка, як ви вважаєте?
So you mentioned also an important aspect is that you have to embed this flotation experience into a psychotherapeutic process. So you wouldn't just tell the people, oh, go to the next floating center and float, but you would have people in your psychotherapeutic counseling, and then with these people decide on which is best for them and have them, if this is basically positive, this relationship and this idea of flotation-REST, because not everybody wants to do this, similar to psychedelic treatments, then this could be something like, also we are on an experimental stage, having people, for example, going in once a week. So we had this with healthy subjects. We had them coming in for 6 weeks, once every week. And people reported about the increase in well-being, and we are still on an experimental level, but this could be my educated guess, once a week, but and then also experimenting with people first going into flotation-REST and then having the psychotherapeutic session, to see how this also changes. So, because you need this integration, similar to psychedelic therapy, you need to have an integration session to what people experience there.
Так, could I ask? Можливо, запитати?
Yes, Влад, будь ласка, так.
Владислав Сіньговський, військовий психолог. Зараз я працюю в клініці Експіо як лікар-психіатр, тому що моя базова освіта лікарська. 2,5 роки я провів в військах, нещодавно звільнився, тому абсолютно підтримую ідею відправити цей flotation cabin на фронт, і ми можемо це організувати практично. Тобто, якщо буде така нагода. Дуже дякую за фантастичну доповідь. Моє питання наступне. Оскільки в клініці ми працюємо з кетаміном, мені цікаво почути ставлення пана Віттмана до кетаміносистованої терапії, тому що дуже багато схожих феноменів породжує кетамін, ну, зокрема, mindfulness, втрата кордонів тіла, і є дуже близьким по феноменології, яка проявляється. Да? Тому мені дуже цікаво почути його ставлення до кетаміносистованої терапії. І друге питання стосовно відповіді. Він каже, психоделіки дають 60% позитивної відповіді, тобто вони в психотерапевтичному процесі. А який відсоток позитивних змін в floating-REST?
So first to ketamine. So my colleagues here at the University of Freiburg, they use ketamine nowadays already on a regular basis, also in psychotherapy. That is only possible because ketamine was already available in the medical field because it was an anesthetic. It was allowed as an anesthetic, so it was always there. And so you didn't have to go through the processes of allowing a certain drug because it was already there. So what people then did, or the medical doctors just did, using reduced doses of ketamine, and then that worked. So they didn't even have to ask for permission for that. And so they say they use it quite successfully, ketamine, for the treatment of depression. And so that I think this is the important thing, that we have to, that we have to have different methods, different induction methods, and we have to show which one is best applicable to an individual person. And this is, I think, future work, yeah, but ketamine seems to work, but I don't know exactly about how responses are, etc. I'm not so familiar with that. And so this very first study is with anxiety. That's your second question, with patients with anxiety. The responder rate was very, very high, much higher than 60%.
Yeah.
And this is also probably due to what the control the individual subjects had, because this was the very first study. So we didn't talk about the mechanisms, because you could also think, okay, if you're in a flotation rest cabin, it's dark, you don't hear anything. A lot of issues will come up. Yeah? So this might not be good for everyone. Yeah? We can talk about this more later. Yeah? But there, in this control condition, in this condition of this very first study, people were very much under control, because with hand waving, movement-sensitive light went on. So the light was on anyway, and they were allowed to switch off the light anytime they felt comfortable. So they had control over what was happening. It was also a very nice open pool in a big room, so they didn't feel claustrophobic, for example. Yeah? Because you have these very closed floating pods, floating tanks, where people, even normal people, might feel claustrophobic. Yeah? So this is also important. Also, our flotation cabin in Freiburg is a cabin. It's actually called Float for Two, because you can also do couple therapy with hypnosis therapy in it. So two people can float next to each other. And it's really, you can stand up, so there's no claustrophobia related to this. Yeah? And in this first study, this very high responding rate is, I think the main thing is because you have this relaxation response anyway. You float there in this warm water. It is very nice, yeah, just to float there. And you have the control over the light. So if you have the light on, you're just as if you were in a wellness spa. You were floating in a wellness spa. That's your impression, yeah? And then you switch off the light, it's dark, and then you can get into these altered states of consciousness, but you have control. So that's why the responder rate was very, very high.
Yeah, clear. Thank you.
Так. Якщо поки немає питань, чи Вадим, будь ласка.
Є. Так, перепрошую. Скажіть, будь ласка, ви згадали, що був досвід 6 підряд процедур. Мені цікаво, чи вимірювалася ефективність на протязі цього курсу впливу методу? Чи вона не змінювалась, чи, можливо, вона зменшувалась? Чи було таке спостереження? Чи вона кожного разу була повністю однакова та повторювалася так само, як і першого разу?
So in this 6-week session, so it was a very first pilot study, so it has never been done before. So we looked at this systematically. We had 5 people coming each Monday. They came in and then they had 6 weeks. And basically to average the findings is that there was a slight increase in well-being, and they liked it very much and were actually sad that it stopped after 6 weeks. But there's another answer to your question, I think, is, and this is very important, that not every float is the same. I think that's what you were asking or implying. I've floated now, I don't know how many times, let's say 30 times. And for me, every float is a little bit different. Sometimes there's not much happening. I'm just in there, and after 1 hour I come out. But what is always the same after each float is this relaxation response, and also I would say this down regulation of mind wandering, that you feel quiet and mindful and you feel very good. this relaxation response. But what happens during really differs from time to time. Sometimes I have just this feeling of total blanking and no time, no self. Sometimes one has even some visual hallucinations, yeah, although it's dark, and it can be very, very different. Yeah? And also inter-individually, it can be very different. For example, I had a student in there, and she had some stress-related issues with family at home, and she was there in the flotation tank and said, and that is the interesting thing, is that because there was no distraction, yeah, no distraction, yeah, you're just alone with yourself in the dark, yeah. A lot of these issues came up, and she was full of these stress-related issues. But at the same time, she said this was really an interesting experience because she had this relaxation response. Everything was less dramatic. So you already see how the therapeutic process might happen, that you basically actualize or relive those experiences in this relaxation environment, and then you can cope better with your issues.
Дякую. Дякую.
Влад, скажіть, будь ласка, у вас ще є питання, чи ми можемо дати слово Андрію?
Звісно, можемо,
Якщо-
звісно. Дякую.
Вадим, я маю ще питання, якщо можна, якщо дозволите.
Так, будь ласка, да,
Да.
потім слово Андрію
Мені,
передамо.
дуже вперше я побачив і хотів би почути більш детально або представити якісь посилання. Оці інструменти вивчення змінених станів свідомості, тобто лінійка тестів, яка застосовувалась, і тому що я вбачаю в цьому велику перспективу, як технічний інструментарій для різноманітних досліджень. Чи буде це відображено в презентації, чи може пан Вітман надасть цю інформацію вже? Дуже дякую.
So I gave titles of some of the articles, yeah? So related to flotation-REST. But what I could do is I could send Inna, maybe if Inna agrees, I could send her an email where I have the links to these articles, which are open access, yeah? Which you just link through the internet. And then if they're not open access, I can send them as PDFs. And Inna maybe then can distribute them, yeah? Should we do it that way?
Yeah, thank you so much.
Я зараз в чаті просто скину скріншот саме з презентації, яку сьогодні пан Вітман давав. І, можливо, ви просто по назві зможете знайти, а потім, може, якщо він надішле матеріали, я тоді в нашому чаті в УПРА теж викладу. Будь ласка, Андрій.
Дякую. Ну, на перше питання я майже отримав відповідь, коли ви сказали, що ви перебували у флоат цій чаші в 1 годину. Це так?
Yeah.
І таймінг сесії – це 1 година.
Yeah, so we have you could say a familiarization session. Yeah. So just to people who are the first time, so they know what it's all about. We do it sometimes half an hour, sometimes 45 minutes. It depends on the people. Yeah? And so if we, for example, if we have meditators, we actually just give them the 60 minutes immediately because they know how to cope with this low, this sensory deprivation situation. Yeah? And interesting, I didn't mention that. So meditators very much
це було
benefit.
моє питання, що ви використовуєте сенсорну депривацію, да? Це аналог віпассани такий, який можна. І чи є у вас, якщо людина вміє медитувати, а якщо ні, це хтось супроводжує, як от у MDMA сесії, чи є там психологи, хто, коли рукою поведеш, лампочка включиться?
Oh, you mean combination, flotation, and substances? Are you implying this?
Ну, якщо людина одна у чаші, да, то там вона керує
Yeah.
світлом, темрявою, ну, температура, я думаю, там стабільно
yeah.
виставляється. А якщо є інші
Yeah.
люди, це
Yeah,
ж автоматика працює.
Yeah. So the thing is, because basically you have this intimate space, because of course you're naked. Yeah? And so you are alone in this flotation tank. But what you can do to secure the connection to the patients is that we have an intercom, yeah. A system with a microphone. So you can have constant contact verbally with the person. Yeah? And plus, they have this control through, let's say, hand waving, that the light goes on. So in this way, I think people are quite secured. Yeah. And you, for example, you cannot drown because it's so full of salt. Yeah?
Я розумію. Да. Останнє запитання. Чи були у вас прецеденти, коли ви були вимушені заспокоювати клієнта, пацієнта, чи переривати процес? Дякую.
So we had only sometimes people stop the process themselves. So they come in for the first time, and then after 20 minutes they come out by themselves. They say, "Oh, this is nothing for me." So this has happened 2-3 times. So it's just because they're there. Some people feel bored. Yeah, there's nothing happening. There's no distraction, and then people just feel bored. This also can happen, and but why do we don't have more of these negative cases? Of course, you still have some sort of self-selection of people wanting to take part in flotation. So if people don't like darkness, if people don't like this wet, salty, dark atmosphere, they know what flotation is, as we tell them beforehand. They just don't volunteer, they don't want to come. So we have this self-selection process. Yeah? So only people who think, oh, this could be something for them, they participate. Yeah? So this is again showing what I said. In psychotherapeutic, these altered states of consciousness induction methods, we need different methods for individually different people.
Так, Вадим, будь ласка.
Так, дякую, Марко. Ви торкнулися моменту, що серед пацієнтів були люди, які мали досвід медитативний. Цікаво, як ця група оцінювала ефект від методу, і чи було якесь порівняння, бо тут можна проводити певну паралель між дією медитації та відпрацьованого вами методу.
So we're now actually conducting a study, a doctoral thesis, and there we have very experienced meditators with at least 1,500 hours of meditation experience coming, at least. So they can have several thousands, or some people even have over 10,000 meditation hours experience. And what we compare is float, rest, but where they just float, or they meditate in flotation rest, having bed rest, and the fourth one, so floating without meditation, floating with meditation, bed rest, and the fourth is just meditating themselves in their own way. And to compare these conditions, this is just starting now. But anecdotally, and that's why we started this, we had several very experienced meditators come in, and when they came out, they told us, like, wow, this was just as if we had been the whole day in a meditation retreat. This is how it feels like. Yeah? Although they didn't meditate. Yeah? So they were in the floating tank and did not meditate. They were just there. But with their knowledge and how to meditate, their skills, they immediately came into the state of deep meditation.
Дякую. Чим більше запитань, тим більше цікавих відповідей. Дякую.
Дякую вам теж за цікаві запитання і можливість розгорнути так цю тему глибше і об'ємніше.
Дякую.
Будь ласка, Романе, друге запитання.
Ну, в мене питання, мабуть, більше буде анекдотичне, ніж практичне. Я з художніх фільмів склав враження, що іноді клієнти флоат-камер вживають перед цим канабіс або невеликі дози речовин. І з цього виходить питання, чи якісь дослідження проводились про стан людей, і чи не є це протипоказом.
So using drugs in the flotation tank, yeah? That's the question. What is known about that?
Так.
Yeah. So,
і чи якось ви перевіряєте клієнтів?
So we did not check, let's say, in the sense of acute effects, yeah? So, but it's very unlikely that we would have people coming into the... So we had a exclusion criteria, so no alcohol, no coffee, no drugs, etc. These were classic exclusion criteria for taking part in the study. Yeah? And from face validity or just talking to the people beforehand, I think we didn't find any person who would be under the influence of a drug going into flotation tank. But that is, of course, an interesting study in itself. Yeah? So the crazy 1960s, you had one of the pioneers of flotation, or maybe the one pioneer was called John Lilly. And what he did in the 1960s, and he wrote books about this, he took LSD and went to the floating tank and stayed there for hours. And these were, of course, these, what you call psychonauts, like astronauts, or they were psychonauts because they were just doing crazy things. And then you had people who just having experience of LSD in flotation tank. And there are a lot of descriptions about this, but of course not as official scientific studies.
Дякую. В мене просто ця картинка з фільму, де дівчина перед тим, як йти в камеру, вона курить і включає магнітофон, пускає собі його в камеру, там певна музика грає, і вона занурюється. Чомусь я відразу це згадав. Тобто це не є протипоказом. А чи варто, я ще почув, чи варто їм дотримуватись якоїсь дієти перед цим, можливо, якихось уникати їжі, якихось напоїв, взагалі за тиждень там до процедури, чи є якісь такі?
Now what you're doing having some interesting thoughts for future retreats. Yeah, I mean, you have retreats in this psychedelic context where you do things like this. Yeah, so you do some have a certain diet. You have to stop drinking alcohol beforehand, and you could think about integrating also flotation into such retreats. Yeah, this is possible. So that would be an interesting alternative way of thinking about all this. Yeah? So I'm totally positive. I mean, what happens is, for example, with let's say THC, so smoking marijuana beforehand, because what you have is anyway initially a stronger interoceptive perception. And of course, then with marijuana, THC, you would even increase that even more. Yeah. And maybe, I don't know what then would happen furthermore, yeah, with that. I know some people recreationally, yeah, so just as their hobby, they have done LSD in the flotation tank. And what, similar to what John Lilly, this founder, did, yeah? And what they say is that actually what he says, but we just have 1, 2, 3 persons I talk to, you don't get even more hallucinations or anything, yeah, but actually less hallucinations, and you're completely focused in the here and now, yeah. So it basically also maybe strengthens some aspects of the experience. But these are just anecdotal reports, and no study has been done so far. I just can say one thing, because this is known. If you go online, there was one person who died in flotation-REST, yeah? Only one. And this was a person who used ketamine in the flotation tank, a strong dose of ketamine. And so you can imagine that this person, he didn't have no sense of bodily self-orientation anymore, and the person actually drowned. Yeah? So this was the one dead person in the flotation tank. Yeah? So that's
Дякую,
not a
дуже
good,
цікаво.
that's not a good last sentence for the discussion.
Ну, у мене ще є запитання. У мене ще є запитання, теж кілька, але задам перше. Стосовно вашого першого слайду, ви там вказували якраз про дослідження мозку, що 2 центри в мозку відповідають за сприйняття часу. І тут мені цікаво, стосовно саме психоделічного досвіду з речовинами, як ви вважаєте, оце змінене сприйняття часу, яке ми завжди дуже часто спостерігаємо під час дозування, під час використання речовин, воно спричинене саме впливом речовини на ці зони мозку, чи спричинене тим, що під час психоделічного досвіду ми потрапляємо в дуже змінений стан свідомості, як можна це пояснити?
Yeah, so if I try to look at this, so I don't know of a study specifically looking at change sense of time under the influence of psychedelics and correlation with brain function. Yeah? That would be, let's say you have an fMRI session and have people judge time, and you record with the fMRI under influence of a psychedelic substance. But if so, this doesn't exist, this study. But if I would interpolate findings, is of course what you find is that the connectivity between different brain regions under the influence of psychedelics decreases. So you have less connectivity, functional connectivity, between certain brain regions. So I could imagine that also this happens to the connectivity of the insular cortex with other brain regions. There is one study with floatation-REST where people went beforehand into fMRI, then they floated, and then they went again into fMRI. And there was also a control condition. What they showed was regions related to what you could say a sense of I were downregulated. So that was the posterior cingulate cortex, PCC, and the posterior insula, which is a primary interoceptive cortex. So PCC and posterior insula, they were both downregulated after versus before floatation-REST. And this is very similar to findings you have in meditation. In very experienced meditator who are in deep states of meditation, we showed this with an individual meditator. The posterior cingulate cortex, which is important for the sense of a narrative self, the sense of I in a narrative sense, is downregulated. And this you also find with psychedelics, that the PCC is downregulated. But I could imagine that is also very much related to the connectivity between these brain regions which are related to the sense of I and other brain regions.
Супер, дякую. Дякую за відповідь. І ще тоді одне питання, вже більше терапевтичного характеру. Є така ідея, що для несвідомого час нелінійний. Да? Тобто саме тому ми можемо звернутися до там нашої внутрішньої дитини, да? До досвіду нашого минулого, і це ніби для певних частин нашої особистості відбувається зараз. Да? Якщо ми повертаємося до якоїсь події, яке трапилося з нами в дитинстві, то ми можемо зробити певні терапевтичні інтервенції там, і це буде відчуватися, ніби це відбувається в той період часу, коли ми ще були там маленькими, да, чи там юнаками. І питання до вас тут більше філософське, можливо. Чи ви з цим погоджуєтеся? Чи це так? Да? Чи для безсвідомого дійсно час може бути нелінійним? І взагалі ця ідея лінійності і нелінійності часу, можливо, я розумію, що це дуже об'ємне питання, але, можливо, якісь ідеї, де можна про це там почитати більш детально.
Yeah, so the experience in the flotation cabin, yeah, is that you some sort of lose the sense of ordinary time, yeah, of linearity. And I think that and also what this could open up, yeah, memory to former states of yourself. Yeah. I think one could use the flotation cabin also, for example, as we're talking about flotation, yeah, in relation to psychotherapeutic or hypnotic inductions, yeah, where you get people back into, let's say, a different time of their lives. Yeah. I think because it's something like a time machine. Yeah, you lose your sense of ordinary time just right now. Yeah, of how it's ticking past, and there you maybe open up for other layers from your past time, from your past lifetime. A little bit related to this is that we had a qualitative study. I can send this also as the PDF then later, where we looked at certain questions, but then had also people tell us about their other experiences, so we didn't press them. So that was just what they came up with. And 4 out of 10 people in this qualitative study came up with this feeling as if they were in the womb of their mother. Yeah? It was so warm and dark, yeah? And they were so relaxed. So they said, oh, this is just as if I were in the womb of my mother. Yeah? So 4 out of 10 came up out of their own motivation, although we didn't ask for this. Yeah? So you could imagine that if through this intercom, yeah, so with a microphone, one can also get into, let's say, a psychotherapeutic verbal communication. And that's what people do. So with psychotherapy and flotation-REST, and one could maybe access certain layers of the person which seem to be covered, but maybe open up.
Дякую. Друзі, якщо у вас ще є питання, у нас є ще трошки часу, будь ласка, можете задати або підняти ручку. Романе, будь ласка.
Я так розумію, що вода має певний процент солоності, так? Це я вже до чого піду, що я хочу спитати. Часто є нейрогенні захворювання шкіри, і скоріш, це як більше підтвердження цієї теорії, що людям це буде протипоказано, якщо там екземи, псоріаз, такі схожі захворювання.
So it's not, that's a very important question. It's not natrium chloride. Yeah? It's not natrium chloride. So it's not basically cooking salt. Yeah? It is magnesium sulfate. Yeah? So it's also in the basically group of salts. Yeah? But magnesium sulfate is actually quite nice for the skin. It makes the skin and hair very smooth. So you could also use it in a beauty parlor to have people go into the flotation-REST. Yeah? And that's what you experience always. And people also say, oh, the skin and hair are very shiny and it's very nice for the skin. It's also that it hasn't been systematically studied, but some people think that maybe also this magnesium sulfate can also have a positive psychological effect on people for this relaxation response. But there's not too much results on that empirically speaking.
І якщо можна, я ще задам питання. Знову ж таки, при тривожних депресивних розладах у пацієнтів бувають часто нейрогенний сечовий мехур або синдром поздраженого кишківника. Чи бувало так, що клієнти переривали сесію, йдуть до туалету і повертаються? Ну, взагалі, як це питання фізіологічних цих моментів? І взагалі, чи бувають якісь реакції фізіологічні такі, які не очікувала людина, і в неї з'явилась потреба там.
Yeah, we didn't experience that. So that's what we do at the beginning before people enter the room with the flotation cabin. We ask them if they don't want to go to the washroom. Yeah, that's what we ask. Yeah, anyway, so this is like a checklist. Make sure. Also, we make sure that they're not thirsty because of the salt environment, they might get very thirsty, dry mouth. Yeah, so at least they have some water beforehand, not too much, but just for the mouth. And we ask them if they don't want to go to the washroom. So we were lucky in this sense of maybe we had 150 people coming, 150 sessions overall, that we didn't have any person who had to interrupt. But of course, with this IBS, this irritable bowel syndrome or so, yeah. So we didn't have any of these individuals. So that could be an important question for future studies with other psychiatric patients. Oh, and one thing is maybe because you lose your sense of self, bodily self, maybe that's also that you don't feel a lot of urges anymore. Yeah, similar as to if you're too hungry at the beginning, you feel some sort of, let's say you have forgotten to eat for many hours. You go in at the beginning, you may feel the sense of being hungry, but I went into several times like this, but then this fades away. You don't feel it anymore so much. Yeah? So maybe you also lose this sensitivity, yeah? Because you're so relaxed then.
Дякую. І останнє питання. Я більше зі своєї позиції, чи якось обробляється розчин між клієнтами, і чи є взагалі потреба в його обробляти, як це в басейнах, хлорування, озонування, чи він сам очищається?
So we have an automatic system, yeah? So meaning after each floating session, for 20 minutes, there's a pump going on, and it goes through a filter system, yeah? Where also chloride is added, and there's a bit of UV light also that has to be done against bacteria. And even at night, so if there is no floats at night, for example, every hour there is a pumping going on for 15 to 20 minutes, yeah? Even if there's nobody in, yeah, for the whole night. Yeah? So, and then the next thing is there are regulations. So we have from the city department of hygiene in Freiburg, yeah? A person comes every 6 weeks we have to have a diary of our measurements. Yeah, this person comes every 6 weeks and does her own controlling, and there was never ever an issue with that. You also have to see with this, just to give you an impression of how salty it is. Yeah, so when we have new salt coming in, we have the salt at a certain level. Yeah? It's only salt in the cabin. It's like 500 kilograms of magnesium sulfate. Then we pour in water, and then it's full water-salt mixture, but this level is still the same as before. So you see how saturated this water then is. It looks totally clean, and you don't see any salt, but the salt water level is the same as the salt level itself. So you see how fully saturated with salt this is. And there are measurements where you see that certain bacteria, after a few seconds, they die immediately. They cannot survive in this environment. And plus, we have this pumping system, etc. So these are very important measures you have to take for the hygiene regulations.
Дякую за вичерпну відповідь.
Я ще скористаюсь можливістю задати питання, тому що ви сказали про те, що Floatation-REST – це ніби така капсула часу, да, і стосовно якраз клієнтів, пацієнтів з ПТСР, ну, у них є така тенденція, що можуть бути флешбеки до травматичних подій, а так як Floatation-REST – це якраз, по суті, стимуляція трансового стану, і в трансових станах цей флешбек може з'явитися. Чи були такі випадки, можливо, з вашими піддослідними, да, чи, можливо, є в літературі якісь згадування про це, і як ви вважаєте, яка була б можлива комунікація в цей момент? Чи потрібен якийсь спеціаліст обов'язково присутній в кімнаті Floatation-REST, якщо ми працюємо з людьми з ПТСР або травматерапії? Дякую.
Because of this intimate situation, there you're naked. What you could do is, for example, have a partner, potentially a partner, sitting next to the flotation cabin. But for example, now I talked about the project in Hawaii on people with PTSD due to the wildfires who lost their homes, maybe they even lost loved ones. And what they install, but they don't even install this intercom. They just trust that this method works, based on their findings with the patients with anxiety. But I agree with you that I would be more careful, and that you would have, for example, a psychotherapist with this intercom, the speaker and the microphone, so you have constant contact with the person. And you, as let's say, a psychotherapist, you can switch on and off the light, and also the patient can switch on and off the light. So if there is really something, so you can talk to him while he's in the flotation, has a flotation experience, and both the therapist and the patient have both control of light. And I think with these measures, I think one is on a safe side.
Дякую. Дякую за відповідь. Друзі, якщо є питання, я думаю, що це останній шанс його задати, і потрошку будемо завершувати тоді сьогоднішню зустріч. Вадим, Артем, будь ласка, да.
Ну, насправді я б хотів би висловити побажання, щоб ці дослідження продовжувалися, бо ми бачимо появу нової перлини, яка безумовно надає і нам оптимізм і зацікавлення, і яка є таким новим кроком, яким додається до методів що конкурують з фармакологічною терапією, до фізіологічних методів, то ми ж будемо з задоволенням очікувати нових результатів від вас та бажати вам успіху.
Thank you very much.
Дякую, Вадим. Я дуже поділяю ваш ентузіазм і вважаю, що це може бути дійсно дуже ефективним таким інструментом для нас, тим паче, коли у нас ще рескеджулінг речовин триває, скажімо так. Я думаю, що це може бути важливим додатковим інструментом в терапії. Артем, будь ласка.
Так, дякую вам за лекцію, дякую за матеріал, дослідження, які ви проводите. З мого досвіду використання камери, деприваційної камери, так, це такий досвід, мені здається, щось таке, наче не знаю, чи перинатального періоду, чи довербального, так. І згадуючи свій досвід, так, ну, я б не сказав, що це легкий досвід. Це десь мій суб'єктивний, да, десь він такий, може бути, був неочікуваний. Неочікуваний. І що, якби, добре, я якби до цього був готовий і так, якось з цим справлявся. Да? Але це справді цікаве дуже місце дослідження. І себе, і мені так думається, що це може бути така практика перед підготовкою до певних психоделічних досвідів, інтервенцій з речовинами, так, в рамках такого дослідження, як альтернатива і медитаціям, чи в доповнення до медитації, так само, як і, можливо, в вже інтеграції певних інтервенцій з психоделіками. Теж, мені здається, це таке цікаве місце і форма такого проживання. І от мені в цьому сенсі хотів спитати якраз продовження питання Вадима, так, які у вас, ну, можливо, в планах, в перспективах дослідження з використанням деприваційної камери, можливо, в комбінації з речовинами, можливо, в рамках як інтервенція в процесі. Якщо у вас є такі, чи могли би поділитися? Дякую.
Yeah, well, first of all, thank you for your reporting your personal experience and adding to what I told your colleagues. So one thing is, as I just said, so we're just starting now with having experienced meditators come into the flotation tank and see what they basically report. So we will have like 30 very experienced meditators and see how maybe that this induces even stronger altered states of consciousness than in non-meditating individuals, and how it compares to them only meditating and then meditating in flotation and floating without meditation. So this is comparable to one study that my colleague in Zurich, Franz Vollenweider, with whom I also had conducted twice studies on psychedelics and how it affects time perception, conducted a study with very experienced meditators. He had 20 meditators, and 10 also got LSD, and 10 others did not get LSD in a double-blind setting. Yeah? And so some of these, we're talking about very experienced meditators, yeah, had meditated for 20 years, 2-3 hours a day, and some of them really said then, wow, now for the first time, so with LSD, I had an experience I always wanted to have, yeah, or a peak experience. Yeah. So we'll see how flotation-REST in combination with meditation works. And the other thing is what we now want to do, because so far we ourselves have not conducted studies with really diagnosed patients. Yeah? So I reported the studies by my colleague Justin Feinstein, yeah, or Feinstein. And what we're now doing is we have 2 doctoral students doing the doctoral thesis on trying to find the feasibility. So they're trying to find out how can these patients get into the floating experience. Yeah? Because as I said, we cannot just have them float, yeah, in darkness and see what happens. We have to get them in different steps into this experience. For example, the first time maybe they have to float with light on, yeah? And then they can switch the light off on their own, but they have maybe then the possibility to switch the light on again. And maybe some people first have to go into the bed rest situation, yeah, which I showed, yeah, that they're in a dark room on the water bed, and they have to first experience this. And so we have to see what are the steps that we can get patients safely into this flotation tank experience. And this is a study that also is now or has started, where we'll also look at patients' anxiety disorders, but not in a big study with many patients, but as I said, in a feasibility study, so a study to find out what are the best ways to get people into the floating tank. And also actually, because that's a big problem, patients with long COVID syndrome. So there are some people who just suffer from exhaustion since they were infected with COVID, and there's no proper treatment for them. So we're also trying to do this.
Та дякую вам за відповідь і за ваші дослідження.
Thank you.
So, okay, I think we are already run out of time. Dr. Wittmann, thank you so much for your time and your interesting lecture.
It was a pleasure.
I hope it will inspire also other colleagues to work in this direction with this topic and maybe with floatation-REST in the future. And yeah, I think we got a lot of interesting answers and topics to think about. So, друзі, я дякую теж вам за чудовий вечір, чудову дискусію, розмову. І до нових зустрічей. У нас наступна лекція відбудеться у листопаді. У нас буде 2 лекції, також тому слідкуйте за новинами і до нових зустрічей. Всім гарного вечора. І
Goodbye to all. It was a pleasure talking to you. Goodbye.
thank you.